All right, class, welcome to lecture number 8, following chapter number 8 in the textbook. We're going to be discussing early and late tissue reactions of radiation and organ systems. We already talked about Clarence Madison Daly. The next person we will discuss is Dr. William Rollins. So, Dr. William Rollins was a Boston physician and dentist who was the first to use collimation and filtration in the late 1800s. After receiving radiation burns to his hand in X-ray experiments in 1898, he used leather and aluminum filters when he made X-ray exposures of his patients' teeth. So the most dangerous thing about X-rays is that we don't feel it, we don't see it, we don't smell it, we don't really hear it. Here we have figure 15, a man being bombarded by invisible X-rays. Again, William Herbert Rollins was the first known advocate of radiation protection. So I've already discussed this before, but we're definitely going to talk about it now. Threshold and non-threshold, linear and non-linear. So threshold is must come to a point before reaction is seen. Below a certain dose, no reaction is observed. That's threshold. Linear is just follows a straight path. It's a straight line. Non-threshold, any dose can show a response. Non-linear, dose does not follow a straight path. You'll need to know which ones are threshold and non-linear, non-threshold, linear. There could be like 4 different combinations. Linear quadratic non-threshold dose. This risk model uses to predict leukemia, breast cancer, and heritable damage. The 1990 BEIR Committee, which is the Biological Effects of Ionizing Radiation Committee, uses the linear quadratic non-threshold dose curve that displays a more conservative dose response outcome for low-level radiation. So what we discussed on the previous slide is LNT, which is linear non-threshold, which is this straight line right here. In this slide, we're talking about the linear quadratic, which is a little bit more conservative. X-ray text, we always go by the LNT, linear non-threshold one right here. But this one, the curved one, is more for leukemia, breast cancer, and the damage that you can inherit. Radiation dose response relationships. Shown are some dose response curves. I may ask you on quiz or test, and definitely on the registry, you will probably see this exact graph, something very similar. Straight line from the zero axis, from zero right here. This would be the y-axis, x-axis. So from the 0, this is the linear non-threshold, saying that any dose can cause a response. Line number 2 showing that you have to have a certain dose to have a response. And here this curved one is also, you have to have a certain dose to have a response, but in this case, the reaction kind of fluctuates right here. Kind of like a bell curve. So terms to know, linear and nonlinear. Again, this is linear. This is linear for number 2. Number 3 is nonlinear. Number 1 is a non-threshold dose. So this is non-threshold linear. Line number 2 would be linear threshold. Line number 3 would be threshold nonlinear. What does dose-response relationships do we use in radiography? We follow the linear non-threshold model, saying that any dose can cause a reaction. Our cancer risk is higher depending on what dose we get. So linear non-threshold model analogy, just similar to like crossing the street. Even if you only cross the street once, you have a certain chance of being hit by a car. In picture number 2, if you cross the street multiple times, you have an increasingly higher chance of being hit by a car. Linear non-threshold model. The Committee on the Biological Effects of Ionizing Radiation, BEIR, adopts the linear non-threshold curve for most types of cancer. If the dose is doubled, so is the probability of biological response. This is a conservative dose response that tells us that we should be mindful of radiation protection. Somatic and genetic effects. Somatic effects on the body or part that was irradiated. Some effects are early or late. Genetic, non-somatic effects, effects that will be onto future generations due to irradiation of genetic cells. Somatic effects. Stochastic effects, random, sometimes called probabilistic effects. Probability that the effects happen depends on dose received. It does not address severity. Cancer is considered a stochastic somatic effect. Tissue reactions, previously called non-stochastic or deterministic effects. Both the probability and severity of the effect depends on dose. Now we're going to talk about early effects. Somatic tissue reactions. As radiation increases, the severity of tissue reactions also increases. This depends on duration of time after exposure to radiation. May appear within minutes, hours, days, weeks. Diagnostic imaging procedures, for the most part, do not have enough dose to cause early tissue reactions. Again, we have a threshold nonlinear curve right here. On the y-axis, severity of biological effects for early tissue reactions. The x-axis, absorbed dose of ionizing radiation. And of course, this is a response to increasing absorbed dose. Early tissue effects. With a whole body dose of 6-gray tissue, many different types of reactions occur. These reactions are termed acute radiation syndrome, ARS, also termed radiation sickness. Whole body dose delivered over a short period of time could be several hours to a few days. Affected populations to this syndrome include the atomic bomb survivors of Hiroshima and Nagasaki, Marshall Islanders atomic bomb testing fallout, nuclear radiation accidents, Chernobyl, patients who have undergone radiation therapy, and uranium miners who got lung cancer. Effects on the skin. Radiodermatitis, reddening of the skin, eventually led to cancerous lesions on the hands and fingers. Desquamation, shedding of the outer layer of skin, occur at higher doses. Epilation, alopecia or hair loss. In medical imaging, cardiovascular or other therapeutic interventional radiology procedures show these effects on the skin. Exposure rates range from 100 to 200 milligrays a minute. Effects on the reproductive system. Dose as low as 0.1 gray tissue can depress male sperm count and in women delay or suppress menstruation. Dose can also cause potential genetic mutations in future generations. So here we have our spermatogonia, spermicides, spermatids, and sperms. In females, primordial follicles that turn into mature follicles that convert to corpus luteum and to the ovum. Sperm cells are constantly reproducing. It takes 3 to 5 weeks for a stem cell to turn into a sperm cell. Ovicells created at birth in the millions and decline in number through life. Only 400 to 500 ovicells are matured and made available for fertilization during a woman's lifetime. Possible effects of high radiation dose. We have nausea, fatigue, erythema, epilation, blood disorders, intestinal disorders, fever, desquamation, which is the shedding of skin, depressed sperm count in the males, temporary or permanent sterility in males or females, injury to the central nervous system at extremely high radiation doses. Acute radiation syndrome, ARS. ARS presents in 4 major response stages: prodromal, latent, manifest, recovery, or death. Acute radiation syndrome, ARS, presents in 4 major response stages. Again, prodromal, latent, manifest, recovery, or death. Prodromal stage. The prodromal period represents the immediate response, acute clinical symptoms of radiation sickness. Length may be a few hours up to 2 days after exposure of whole body dose of more than 1 gray tissue. Higher the dose, the more severe the symptoms. Latent period, the time after exposure during which there is no sign of radiation sickness. It's a well-being period, can be mistaken for early recovery. The latent period is also dose dependent. At higher doses, the latent period is as short as a few hours or less, while at lower doses, it can last several days or weeks. Manifest illness, the stage of acute radiation syndrome during which signs and symptoms are apparent. 3 illnesses identified: hematopoietic syndrome, gastrointestinal syndrome, cerebrovascular syndrome. Hematopoietic syndrome, also known as bone marrow syndrome, whole body dose of 1 to 10 gray tissue, causes blood cell numbers to decrease. Body becomes more prone to infection and bleeding. Survival time shortens as radiation dose increases. Death may occur 6 to 8 weeks after dose of 2 gray tissue. As dose increases from 2 gray tissue to 10 gray tissue, individuals will die in a shorter period. If exposure in the range of 1 to 2 gray tissue, bone marrow eventually repopulates. Recovery in 3 weeks to 6 months after radiation is possible. Gastrointestinal syndrome. GI syndrome has a threshold dose of 6 gray tissue. Syndrome peaks, however, after dose of 10 gray tissue or greater. If receiving a dose of 6 to 10 gray tissue, individuals may die 3 to 10 days after being exposed. Results from the damage to cells lining the intestines, infection, fluid loss, and electrolyte imbalance contributes to death. So again, gastrointestinal syndrome, some cells regenerate before death, but since many cells are damaged, death usually occurs before full regeneration is complete. Firefighters and workers of Chernobyl are examples of humans who died as a result of this syndrome. Cerebrovascular syndrome. This syndrome deals with the central nervous system and cardiovascular system. A dose of 50 gray tissue or more. Death within a few hours, 2 to 3 days after exposure. Injury injures blood vessels and permits fluid to leak into brain. Causes intracranial pressure, coma, and death. Death or recovery phase. After illness, manifest chances of survival are slim. Death is the usual outcome. However, if a dose of 2 to 3 gray tissue exposed person passes through the first 3 stages of acute radiation syndrome, but displays less severe symptoms, recovery is possible. Recovery may occur over the course of 3 months. These people will, however, show signs of radiation damage and experience late effects. Here's a checkpoint slide summarizing everything. Prodromal slide, dose 1 gray tissue, symptoms nausea, vomiting, diarrhea, fatigue, leukopenia. Latent 1 to 100 gray tissue, really no symptoms. Hematopoietic 1 to 10 gray tissue, 6 to 8 weeks survival time, doses over 2 gray tissue. The symptoms for hematopoietic are nausea, vomiting, diarrhea, decrease in number of red blood cells, white blood cells, and platelets in the circulating blood, hemorrhage, and infection. Gastrointestinal stage, 6 to 10 or more gray tissue. Average survival time is 3 to 10 days. Symptoms for GI is severe nausea, vomiting, diarrhea, fever, fatigue, loss of appetite, lethargy, anemia, leukopenia, hemorrhage, infection, electrolytic imbalance, and emaciation. Cerebrovascular stage, 50 or more gray tissue. For dose, average survival time, several hours to 2 or 3 days. The symptoms include same as hematopoietic and GI, plus excessive nervousness, confusion, lack of coordination, loss of vision, burning sensation of the skin, loss of consciousness, disorientation, shock, periods of agitation, alternating with stupor, edema, loss of equilibrium, meningitis, prostration, respiratory distress, vasculitis, and/or coma. Here we have a video of the radiation myths, truths about radiation sickness. Now we're going to talk about late effects. Major types of late effects. Three major types of late effects with radiation are carcinogenesis, cataractogenesis, and embryologic effects or birth defects. Carcinogenesis. Cancer considered the most important late stochastic effect caused by ionizing radiation. It's random, does not have a threshold dose. We're going to talk about the absolute risk model. This model forecasts that a specific number of malignancies will occur as a result of exposure. Here it's not the LNT model, this would be the linear quadratic where it has a curve. The relative risk model, also threshold dose with a curve. Relative risk model, this model predicts that the number of excess cancers will increase as the natural incidence of cancer increases with advancing age and population. So as people get older, their risk of cancer increases. Atomic bomb in 1940, bomb survivors had spontaneous leukemia. 1950, they had incidental excess cancers, which included thyroid, lung, breast, and bone cancer. So the first cancer that was exposed was leukemia, and then additional cancers popped up 10 years later. Cataractogenesis. Chance that too gray tissue will induce the formation of cataracts, partial or complete loss of vision. Radiation-induced cataracts showcase a threshold nonlinear dose-response relationship. Threshold is now considered to be 0.5 gray tissue. In diagnostic radiography, this would happen with lengthy fluoroscopy procedures. Embryologic effects, birth defects. Different periods of gestation have different radiation responses. So pre-implantation is 0 to 9 days. Organogenesis is 10 days to 12 weeks. Fetal stage is 12 weeks to term. Pre-implantation phase, the dose range is 0.05 to 0.15 gray, can cause embryologic death. So from 0 to 9 days, most likely death will occur. Organogenesis may result in death as well. Severe congenital abnormalities, stunted growth, intellectual disabilities, genetic deformities, organ damage. Developing embryo fetus most susceptible to damage in this first trimester. So pre-implantation is death within 0 to 9 days. Within the first trimester, within 10 to 12 weeks, that's when mutations or genetic defects occur. Fetal stage. Second and third trimester, less susceptible to radiation than first trimester. Congenital abnormalities and function disorders can be caused by radiation exposure, sterility, or cancer. Genetic effects. Radiation damage to ova or sperm cells leads to mutations. Radiation deemed a mutagen, which is increasing the frequency of mutation. Studies show heredity effects do not have a threshold dose. No such thing as a 100% safe gonadal radiation dose. Double dosing is radiation dose that causes the number of spontaneous mutations occurring in a generation to increase to 2 times their original number. Example, if 5% of population has mutations without radiation, the administration of radiation would cause the number to eventually increase to 10%. Late effects of radiation, tissue reactions, stochastic effect, and teratogenic effects. Teratogenic effects, effects of radiation on the embryo, fetus, and utero that depends on the fetal stage of development and the radiation dose received. So here we have late tissue reactions, which usually happen with kids and adults, but mostly for kids. Cataract formation, fibrosis, organ atrophy, loss of parenchymal, which are functional cells, reduced fertility, and sterility. Teratogenic effects are anything that have to do with kids, embryologic fatal or neonatal death, congenital malformations, decreased birth weight, disturbances in growth and or development, increased stillbirth, increased mortality, infant mortality, childhood malignancy, childhood mortality. Stochastic effects is cancer, genetic hereditary effects. Lethal dose. So here the lethal dose is term used to describe the dose of whole body radiation that will be lethal to a population. Lethal dose 50-30. Lethal dose that will kill 50% of the population in 30 days. Lethal dose 50-30 for adult humans is estimated to be 3 to 4 grade tissue. Whole body doses of 6 grade tissue will cause death of the entire population in 30 days. When medical treatment is given, some humans have survived doses as high as 8.5 grade tissue. Whole body doses of over 12 grade tissue are considered fatal. Lethal dose can be described in various aspects where the first number represents the percent of population, the second number represents the amount of time to die. In this case, LD 50-60 is considered a more accurate measurement for humans. The LD 50-30 for adult humans without medical intervention is also important to remember. So here's a summary of serious radiation-induced responses of concern. Tissue reactions, you have early reactions, erythema, which is diffuse redness over an area of skin, blood changes, which is like a decrease of lymphocytes, epilation is loss of hair. You have your ARS, your acute radiation syndromes, which are hematopoietic, GI, and cerebrovascular. You have late reactions, cataract formation, fibrosis, organ atrophy, loss of parenchymal or functional cells, reduced fertility, and sterility. Those are all tissue reactions. Stochastic or probabilistic effects are cancer, genetic effects, and mutation of DNA.